It was terribly emotional. I felt every part of my spirit, my being, everything that I had leave in an instant.
I was with a communications company in the Valley, and as they periodically do, they lay people off.
Once upon a time, my life probably wasn't much different than yours. And then I became sick. Then I became homeless.
I had no financial concerns, living in a beautiful home.
Things can change very quickly for a working poor family. A job loss, a medical emergency, domestic violence. And suddenly, they find themselves in a desperate situation.
My now ex-husband chose a life of drugs over his family. It was so severe that we left one evening with 2 weeks of clothes, and that left me alone with 2 minor children, very small babies.
Trust me when I tell you, plans go awry. Money goes away. It could happen, and it could happen to you.
A man chose to run a red light and T-bone me. It left me injured and unable to work. Within a very short period of time, we were evicted. The constable was there in front of the children, and we were left homeless in the back of my vehicle with no belongings. There was a long period of time that I was going day to day. Very uncertain period of time in my life, and very fearful. What to do next? Where do I go? Somebody mentioned St. Vincent de Paul.
I feel it's up to us here at St. Vincent de Paul to grab the client when they first walk in, when it's their very first visit, to let them know that we can assist them with whatever they need. They're not the only one homeless, and that it can be us in their shoes.
I was treated with a lot of love and compassion, and I just almost collapsed in the lady's arms.
I'm sitting in the hospital. The guy says, you don't have any insurance. We're going to put you in a cab and we're going to send you down to a shelter. How am I feeling? I'm thinking maybe it couldn't get much worse than that.
The people that come to Ozanam Manor vary quite a bit. The thing that they have in common is that although they're doing their best to get out of a very difficult life situation, it's impossible to do it on their own or right away.
I'm a resident of Ozanam Manor. I've told people on the outside that I'm homeless, and yet they look at my dress, my cleanliness, and they stare at me like I've just told one whopper of a lie, because apparently to them I don't look homeless.
They helped me pay rent, and they helped me stay afloat. They were able to feed me.
The ELISA family, they have actually been walking to and from our dining rooms, which is a 4-mile round trip, and they've taken the time. The children love coming.
I feel really good because my kids eat good food, fresh salad and hot food on the table, and that helped me.
The need is huge. The need continues to grow on a daily basis.
Last Saturday, they called me at 11 o'clock, my son, and he told me that his neighbor, his kids didn't eat at all day. And we made 3 food boxes for him.
I was in a bind. I have 5 children. I'm a single parent. When I was off work after I had a baby last year, I couldn't pay my bills. I couldn't put the food on the table for the children. This year I had to get knee surgery on my knee, so I needed help also again. About my children, they're my world. St. Vincent de Paul has really helped me a lot. I don't think I would have food for my children or light, water, without me working.
There's a lot of humanity suffering, and I've walked it, and I've seen it, and I've lived it.
The people who are serviced here at this clinic are a special group of people. They're working hard to try to make ends meet, but they don't have health care available to them.
I came for my glaucoma. If I didn't get it, I would lose my eyesight permanent.
If they're not worried about managing a medical crisis, they can hold a job. They can be productive at the job.
I am a single parent with 2 kids. I have a 9-year-old and a 12-year-old, and I'm working.
A lot of the people that we're seeing here haven't seen a doctor maybe for 2, 3, 4 years, a lot of the adults.
Many of our students have never even been to see a dentist or been in a dental chair. First of all, their parents can't afford it. Secondly, their parents do not have insurance.
There's an abscess on this tooth, and it's why I guess it kept her out of school today. And she said it kept her awake all night last night.
It's just a tremendous thing. I mean, you really feel like you have made a difference in that child's life. Now you'll be happier in school, do you think? Okay, study hard, okay?
It's no easy feat to start from nothing and start over in life. And they were my support system. I knew that they were there. I'd get my call every week. How are you doing? What do you need this week?
They said, we have a program here, and it's the Opportunity Program, and it's designed to help you find a better job, help you with resources.
They gave me a use of a computer if I didn't have one to redo my resume and post it online.
My mentor, who has gone above and beyond, at least to me, has just been a godsend.
I'm back in my old industry. We're in a better place today. It is a gradual climb, but I have never stopped.
I can sit here with you now, preparing to move into an apartment and live the balance of my life, free from worrying about future debt, having learned how to budget my money, having my physical needs taken care of.
St. Vincent de Paul is absolutely critical, and we're at a critical stage today with the economy and where society is.
I'm just so grateful to Ozanam Manor, the staff, because they did literally save my life.
I would have never seen humanity as I do today because I've been there on both sides. I still carry pain, I still carry fear, but I still have a lot of hope.